Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical health care. I would like to welcome Dr. Alan Bauman, an internationally renowned, board-certified hair restoration physician, author, lecturer, and new treatment pioneer, who has treated nearly 20,000 patients since 1997. He is one of only a handful of surgeons worldwide who is certified by the American Board of Hair Restoration Surgery. As a specialist in optimum hair health and hair restoration, Dr. Bauman is an advocate for holistic, multi-therapy approaches to health and wellness. Good morning, Dr. Bauman. Thank you so much for joining us today. We really appreciate you sitting down with us and taking the time out of your day.
Well, thanks so much for having me.
So let's go back to your younger years, although you look like you're about 20 years old. It's like Dookie Howser sitting in front of me. Sorry to embarrass
it's an anti-aging business,
exactly.
Right?
So you're doing something right. So let's go back to your childhood years, let's say, and what first inspired you to go to medical school or to study the sciences?
Well, if you ask my grandmother, who's since passed, when I decided to go to medical school, she would have said, the day he was born. So in the family, it was kind of preordained that that was the direction I was going. And I guess it was kind of a good idea that, or it was good that I was okay in science, and I was interested in science and technology. So I did okay in that pathway. But it really wasn't until I was in, I would say, high school that I become interested in the more surgical aspects of medicine. But I always knew I was going into medicine. That was like, it was not even a choice.
You had physicians in your family?
Yeah, so my dad is a dentist. My uncle's a gastroenterologist. My grandfather is a PhD and a college professor. So, there was a lot of board-certified whomevers in the family. But my first mentor in medicine was a plastic surgeon.
So then what sparked your interest in getting into hair loss restoration?
So I didn't really know anything about hair or hair loss at that time. As a teenager, I was watching my dad go bald, though. I was watching my dad lose his hair. And he went from thinning to a comb-over to lotions and potions, and actually eventually into a hairpiece at that time. And so I think that was an early education about how hair loss affects people. And I kind of blame myself and my sister. We did make fun of him as he was going through that process. And seeing, how he struggled, though, really was deep in my memory about how people are affected by their hair. And then, of course, when I was in college, I grew my hair very long, That was exciting and fun. In fact, even in medical school, I had a ponytail. Most people don't know that.
We might need a photo of that.
Yes. So, okay, that's in the archive.
Okay.
Yeah, that's in the safe. But so I didn't really know that hair loss was going to be something that I would end up treating. My grandmother always told me, go into something that the family needs. So I figured she meant psychiatry, like most families.
Right.
And then maybe cosmetic surgery. So then, that's kind of how that went along.
Oh, that's
I
great.
pursued the path of surgery through seeing plastic surgery really as a teenager. So I had a very unique opportunity to literally look over the shoulder of one of the most prominent plastic surgeons in Manhattan as he was doing his business, doing his work, working with his patients, talking to them about what they'd like to achieve. Seeing the work being done, literally just a few feet away over his shoulder in the OR. And I will never forget that first surgical procedure that I saw. I just knew that that was going to be my path. And to see his results, to see how he changed the lives of those patients and how happy they were and thankful and how it gave him a boost as well. So that was an early lesson, I think, on, psychiatry with a knife, I guess, if you put it in my grandmother's terms. But, how cosmetic surgery and cosmetic procedures can really change somebody and change their lives for the better. Went to college and then medical school in that pathway, college in California, medical school back in New York. And I always stayed in very close contact with my mentor in plastic surgery, even though I kept my mind open and looked at all different areas of medicine, but always gravitated back to surgery and always had kind of cosmetic and reconstructive surgery in my mind. While I was in my surgical residency program in New York, that's when I first learned about hair transplants. And it wasn't through a book or a journal. It wasn't through a late-night infomercial. It was through meeting a patient who had had the work done. And he was having something else done at the time. And my job as a surgical resident at that moment was to get a medical history and a surgical history. And he began telling me he had this, he had that, and these were his issues. And he was having this procedure, and he also had had a hair transplant. And I found that kind of distracting because I was looking at his hair, trying to figure out which part of it was transplanted and which was not. And this was in the 1990s. So this was during a time when, in my mind, I thought hair transplants were pluggy and unusual looking, and why bother? And learning from him, really just from a layman's exchange of information, I was surprised. I mean, I was really blown away by the work that he had done to recreate his hairline. And he explained to me, single follicle implantation, one hair at a time, using an artistic approach. And it came out of a conversation with something like, well, do you mind if I ask where you had your hair transplanted? And he said, oh, up in Toronto. I'm thinking, we're in New York. Why did he go to Toronto? But the question was really, where on his scalp did he have the hair transplanted? Because I was unable to tell. So I guess being fooled by that surgical result kind of shocked me and opened my eyes to maybe there was something to this. And that maybe there was something I could do either to incorporate this into my path of plastic surgery or, just at least it deserved a second look. And that's how it all, that's the path. That's how that fork in the road kind of happened. Little by little, I learned more about hair transplantation almost by accident.
And it wasn't as prevalent at that time to see a plastic surgeon specializing in hair transplantation?
No, I didn't know anybody who was a plastic surgeon who did hair. And neither did my mentor, by the way. But he said, oh, yeah, you should look into that. He thought it was a good idea. And it really just came down to when I was traveling to different cosmetic surgery and plastic surgery conferences, sometimes there were little bits and pieces that we would see, a multidisciplinary conference, and there was something on breast augmentation and lipo, and then there was a little bit about hair transplantation. So I kind of peek in on that, try to get a little bit more information. Really, through a friend of a friend, I was able to connect with a hair transplant surgeon out in Long Island, New York, and it was just a brief call, and I said, hey, I'm Dr. Alan Bauman. I'm a surgical resident. I'm going into plastic and reconstructive surgery. I don't know anything really about hair. Do you mind if I just come by and ask you a couple of questions if you have a moment? Or can I observe a procedure? And that was always ingrained in me through my mentor, that you kind of have to go to where the knowledge is. And so I was prepared to travel wherever I needed to be to see it. And it just so happened that in New York I could see this. And so we ended up hitting it off very well. And he ended up becoming my second mentor in surgery and really my first in hair transplants. And I ended up, really after a very short period of time, working together very closely with him day in and day out on my post-call days from general surgery. I would take the train out to Long Island, New York, and operate with him. Not doing a total procedure start to finish on my own, of course, but helping him doing different parts of the procedures. Doing everything from what a technician would do. For example, microsurgical dissection or implantation of the grafts, which are never done by the surgeon, always done by the medical assistants or surgical assistants and now PAs and LPNs and nurse practitioners and such. But doing that work and then eventually doing parts of the surgical part of the procedure. I was able to kind of help him in his practice. So that was an informal fellowship that I did for about a year or so, and then I was ready to roll.
So there was no formal fellowship at that time?
So in the 1990s, there was no such thing as board certification for hair transplant. There were no formal fellowships that were arranged and certified and so forth. So it was really an old-fashioned mentorship, which I was okay with. I mean, that's basically what I was doing with my first mentor, who was a plastic surgeon. I mean, I was just being groomed in that way. And now, I had this amazing opportunity as a licensed MD to work in a hair transplant practice. But it sounds all bright and sunny right now, but at the time, it was contentious with the family. Because at that time, when I told my parents and those in my family who had supported me through medical school and so forth in the career going towards plastic surgery, and I told them, hey, I'm thinking about doing hair transplants, they thought I was completely off the reservation.
Because your grandmother wanted the facelift, or what?
No. They just figured, like what I had assumed, that it was pluggy and painful, and, someone said, well, isn't there a pill for that? I mean, there was like, you'll never become board certified. This is like, what you're throwing all those years and training and connections with the surgeon away for nothing. And I felt something completely different. I mean, I was standing on a different hill, if you will. So my perspective was different. I felt that this was a time in the 1990s that things were changing in the field of hair transplants, that we were getting away from the painful, pluggy work, getting into that microsurgical aspects, and it kind of looked like the industry was on the verge of a huge revolution. And I wanted to be a part of that. So that's where I decided, well, maybe I'll take a year and see how this works out. And if it doesn't work out, then I've got to figure out my way back into the regular path.
Did your plastic surgeon mentor friend, did he give you advice either way in which direction he felt you should go?
I was lucky because he was very supportive of whichever path I wanted to go. I think he was looking forward to working more with me as time went on, but obviously, our paths diverged at that time. Yeah.
So let's get back to when you were out on your own as a surgeon and doing your very first patient. Mm-hmm. That was your patient that came in to see Dr. Alan Bauman. Mm-hmm. What was that like?
So it was, first of all, very exciting and stressful too, because I had moved to Florida, to Boca Raton, really without any network of referrals. I had no network of friends or colleagues in the area that I knew of at the time, and so I came to build the office and do it all from scratch. So everything was leveraged to the hilt. Failure was not an option. I was engaged to be married, but we didn't have kids at the time. And it took a year, really, to build the office, to build it out the way that I wanted to. It was a small space. It was about 1,000 square feet. I dragged my wife out of her job and put her in the front desk, and I did the consultations. And that first procedure...
Were your hands shaking?
No, of course not. I mean, I'd done plenty of surgeries, up in New York. Not only, literally seen hundreds of hair transplants by that time, but hundreds and hundreds of other procedures. So I wasn't really stressed out about the procedure at all. I think that I was excited to perform it, to kind of get it going and really to make it happen for that patient. Looking forward, wishing that time from the surgery itself, much like a patient would, having the procedure, waiting to see the results, I was in anticipation of that for many, many, many months, because it takes time. You have to heal, and then it takes time to grow, and then...
And how did that patient first find you?
That's a great question. I don't really remember how the patient came to us, but I'll tell you how it happened. Because I didn't have dollars for advertising. We were on a shoestring budget to open the practice, and this is in the 1990s. There was no social media. You couldn't go on YouTube. It was through word of mouth. And I worked for a year, even after coming to town, working through the Boca Raton Chamber of Commerce, working with charity events to get the word out and bringing my portfolio literally almost door to door to plastic surgeons who were in the area, dermatologists who were in the area. Many of them were great friends of mine still. And hairstylists and salon owners, showing them, kind of my book of work, my artistic portfolio that I brought with me from New York. Because I had those results.
Now, at this point, did the American Board of Hair Restoration Surgery exist or not at that point? So now you are one of an elite group, you're part of an elite group of only a handful of surgeons, correct, with that designation?
Correct. So, years later, thankfully for my family, board certification became available. And so that's one of my more proud moments over the past 20 years in the field is sitting for the board certification. And in fact, just last year, I got my recertification. So it's pretty exciting to sit for that rigorous, intensive examination. Not only a written exam on one of the days and then a series of oral exams on the next day from my colleagues and peers who were basically grilling me on everything from my medical judgment, artistic judgment, what to do in emergencies and things like that, and how to get great results. So there's really only a small number of physicians and surgeons in the world that have reached that American Board of Hair Restoration Surgery designation. And so, but it's really exciting to kind of jump that, to prepare and jump that hurdle when it became available. Because before that, there was nothing that was a specific test for hair transplant surgeons. So it was really cool to be able to do that. So my parents were always supportive. They said, well, if you're seeing it this way, then go for it and do it. My dad and actually my parents were very supportive in me starting my own business as opposed to going in with another surgeon and being an apprentice in that way or a partner in another practice. So they were very, very supportive in that part of it. The entrepreneurial spirit is very strong in my family. My dad is a self-employed physician, dentist, and he was very, very encouraging. In fact, I remember asking him, do you think I should go and take a look at this contract with this other surgeon, hair transplant surgeon, or should I do it on my own? And he said, well, I think you should do it on your own, but don't take my word for it. Let's ask my friends. They'll be here for a July 4th barbecue. So I remember going around the pool, so to speak, during that barbecue, asking many of my parents' friends who were entrepreneurial and business owners, and they said, for sure, you got to do it on your own. So they were very supportive in that way. Now, the rest of the family, I think it was after 2001 where I was featured on CNN that I start to get some calls like, okay, maybe this will work out for you.
That's great.
So I think, not to say that that was the ultimate turning point, but I think when the word started to get out that we were doing something completely different than what most people thought of in hair transplant, that's when the tide began to turn in some of the family members maybe who were more skeptical about the path that I chose at that time.
How is the hair and scalp tied to aging and overall wellness and health? And to that end, how did you come to find A4M?
Okay. So, well, first of all, the hair and scalp is uniquely tied to health and youth and beauty. Hair is an amazing barometer of how healthy you are. And it's probably because hair follicles are so numerous when we're young, and they are highly metabolic. They're working very, very strongly every single day to make a good, healthy hair fiber. And it probably goes back evolutionarily that hair is an outward sign of beauty and youth. Because as you age, as problems happen, whether it's nutrition or inflammation or other issues that can occur, of course, with aging, your hair not only looks different, and in men, receding hairline, balding in the crown. In women, it gets thinner, less voluminous. They can see changes to their hairstyle that they have to make because it's so thin. It's very obvious that changes are occurring as age is going along, or if they are not healthy inside, if there's something imbalanced. So when you look in the mirror and your hair is doing great, I mean, come on, you're having a great hair day. And you know that if you're not having a great hair day, that can affect you psychologically. And so for our patients who are struggling with the hair loss condition, sometimes a bad hair day can turn into a bad hair week and month and year and a bad hair life. And it may be beyond their control of what's happening, either genetically or medically. There's a lot of factors that influence the hair follicle. So I've always been excited about the A4M. And I think it was back in the 1990s when I attended my first A4M conference. So I've been a member of the American Academy of Anti-Aging since probably 1998, 1999. So
how were you first introduced?
I will tell you, my hair transplant mentor was very keen on the work that was being done and compiled by Dr. Klatz and Dr. Goldman. And he really introduced me to the American Academy of Anti-Aging. I think he was a member. I don't know if he ever attended any of the conferences or not, but I know he had the book, Grow Young with HGH, which was, widely popular around that time in the 1990s. So I was very much intrigued with the idea. And just like I felt way back when that maybe as a budding plastic surgeon I should be looking at hair transplantation, I felt that as a hair transplant surgeon, I was not only personally interested, but I thought maybe my patients would also be interested in what are the modern methods of combating the aging process, or, as they say at the A4M, not just, more years in your life, but more life in your years, And so it's always, I don't focus on anti-aging, but, I have that tendency to bring those things that I've learned and been exposed to through the A4M into the practice. I'll give you some examples. Low-level laser therapy, platelet-rich plasma, cell therapy, stem cells. These are all ideas and concepts for me that I learned about mostly through the American Academy of Anti-Aging Medicine, not through journal articles or other, or other outlets or the news media, but I heard it first here at the A4M along with many other things too, but those are the ones that really have changed the way that we practice hair transplantation, hair restoration, and hair loss management.
So how has, obviously, the specialty of hair restoration has changed vastly over the last 20 years, and with what you just mentioned with PRP and stem cells, et cetera, it is continuing to change, at an incredible pace. Sure. So where do you see it going over the next 10 to 20 years?
Wow. So hair transplantation has changed dramatically since those early days in my training, where we took strips and put stitches or staples and, manually dissected these grafts under the microscope. I mean, that's old school today. Today we use minimally invasive microsurgical techniques to take the individual follicular units, as little as a single hair follicle, out of the scalp at one time. And we do literally thousands and thousands of those grafts during a single session of transplantation today. And we've used a variety of different tools, dating back to the early 2000s. Some of those I designed on my own, manual devices, to semi-automatic devices that you could use almost like a dental handpiece, to what we use today, which is robotic-assisted FUE surgery, or follicular unit extraction, with the most sophisticated semi-autonomous surgical instrument on the planet, the ARTIS hair restoration robotic system. So the technology of getting the hair has changed dramatically to a no scalpel, no stitch harvesting process, much less downtime, quick and easy, no linear scar left behind. So we've made that harvesting process much less invasive and much more easier to recover, faster recovery, much more comfortable to recover from. And when you combine that with the artistry of hair transplantation, which I think evolved a little bit before, making single follicle implants into the hairline or the eyebrow area or even eyelashes to create something that's completely 100% undetectable, that's where the industry has come from and gone to now. Where I see it going in the future, it's exciting. I mean, I think that we're going to have more and more non-invasive therapies that will work. Cell therapy is going to continue to be an important part of what we do, whether it's enhanced PRP, maybe with adipose stem cells as we're researching today, or some other engineered cell or harvested and replicated cell in the laboratory that maybe we can re-inject back into the scalp, to literally eventually hair follicle cloning. This will be the holy grail of hair transplant surgery, to give us, for sure, an unlimited supply of hair follicles for transplantation. So it's an exciting field. It changes so fast, and that's why we do so much traveling and listening and chatting with our colleagues to figure out what's coming next, so that we can take that from the bench to the bedside to our patients who are really struggling with the hair loss condition and changing their lives.
What would you say are the biggest challenges facing your industry?
Well, I would have to say that the industry is faced with enormous challenges, and the challenges today are different than they were years ago. I think years ago, as the FDA-approved medications started to become available, people realized that this is a viable, medically treatable condition, the hair loss situation. And as our hair transplant results got better, meaning more artistic and less invasive, we were seeing a lot less corrective work, and that was an exciting time in the field. What's happening now is that with the advent of these different devices that are available for hair follicle harvesting, unfortunately we see physicians who kind of want to add hair transplant as a secondary item or a menu item to their repertoire. And while I encourage physicians to expand their practice, I also would encourage them to get educated. And I think that sometimes they put the cart before the horse, meaning that they'll go out, get these devices, it's implemented over a weekend, and unfortunately a weekend is not enough to be able to help a hair loss patient with a hair transplant surgery. It's not enough training and experience. So we're seeing so many more reparative cases these days, inappropriately designed hairlines, wrong graft counts, many, many more problems, unfortunately, than before. So while the industry is trying to grow, these are the growing pains. And so what does it mean for the consumer, the patients who are out there? They have to do more homework, more due diligence than ever before to find experienced, board-certified, technically skilled physicians and teams to be able to do this kind of work. And that can be challenging, Because, Dr. Google just provides everything up, everything bubbles up to the surface. So you have to go, not just to page 1 and 2 in Google, but you're going to have to dig a little bit deeper and, not necessarily rely on late-night infomercials and things like that for information in this field.
On the website, International Alliance of Hair Restoration Surgeons, it reads that you're an advocate, you personally are an advocate for holistic, results-oriented, multi-therapy approach to treatment hair loss. So other than what we just discussed with PRP and stem cells, et cetera, what kind of medical and surgical techniques do you utilize in your practice to help patients maintain and or restore their hair that many of our functional or integrative physicians would be able to appreciate?
Yeah. So what's been interesting over the years that I've had the opportunity and the privilege to present to members of the A4M, my colleagues who are here, who are not in the field of hair restoration, really has to do with maybe some of those things that they're treating that are influencing the hair follicle. So the hair follicle is an amazing, probably one of the most sophisticated mini organs in your body because it's responsive to changes in blood flow and oxygen and nutrition, and it's receptive to spikes in cortisol and inflammation and stress and so forth. It's uniquely responsive to all of those things. It has its own blood supply. It has its own, every follicle has its own muscle. Every follicle has nerve endings that surround the hair follicles. So it's not just a psychological and outward appearance of aging that we're dealing with, but very much a barometer of how the body is doing. And many of our patients that we see in the realm of anti-aging and age management who have hormone imbalance or abnormalities, many times some of their first symptoms have to do with their hair. So the challenges occur that when you start modulating hormone levels and other things, you can sometimes affect the hair in a positive way, but also sometimes in a negative way. And I think that's the most important thing for my colleagues in the A4M to really understand. And I've kind of been beating this drum for many, many years, that just as an example, if you increase the hormones of testosterone, for example, exogenously, for a man or a woman who happens to be uniquely sensitive to those androgens in their body, that you may inadvertently exacerbate a hereditary hair loss situation. And so hormones and hair loss is a common topic of my presentations, and I don't know if my colleagues are tired of hearing about it or not. We try to present it in many different ways, but I think that it's uniquely tied to what we do in the field of anti-aging and age management to understand what are those risk factors that can influence those patients. And if the patient is not so concerned about their hair, then that's okay. That's not a problem. But maybe you want to ask them ahead of time. And I think you'd be surprised, maybe the hair loss situation is what brought them in to see you. And their knowledge about hair loss, my colleagues' knowledge about hair loss would be invaluable at that moment because the hair loss is maybe a sign or symptom, as I said, of that inflammation or of that aging process or of hormone imbalance. And we can rectify and treat those things. We could try and improve hair growth because once the follicle is dead and gone, then the patient has only one path to restoration, and that's a hair transplant. So the holistic approach to hair loss and hair restoration is to try to affect the functioning of the hair follicle, to protect it and preserve it and enhance it. And that's what those holistic measures that we employ really do. And I think that's one of the things that separates my practice from many other hair transplant surgeons who are really just concerned about, do you have a follicle there or not? And that's really not what we do. Over the 1,000 patients that see and come seek help from us each year, the vast majority of them may never ever need a hair transplant. So we're going to try to get down to the bottom line. If it's a young male with male pattern hair loss, then his fate may be set, and his path is going down that road unless we do something to prevent it. But we do see a lot of men and women in middle age and over who are struggling with hair loss situations that their follicles are influenced by a number of different problems that we try to dissect out from them during the medical consultation. And so we'll do the lab work, the blood work. We're spending an hour asking the questions about their social situation. Are they having trouble sleeping? Are they having energy issues? Are they having inflammation and other things that could be affecting their hair? Try to dissect out if they're having those symptoms and issues. Not to say that I'm going to treat all of those things at one time. I rely on my really, really intelligent colleagues in the field of anti-aging and age management to help out with those things. But I make them aware that these are things that can definitely affect the hair follicle. And if you have a lot of things that are working against you in that way, we may have to work a little bit harder to push on the follicle, make them do what we need them to do, which is to grow an awesome, healthy, thick, and beautiful, shiny head of hair.
What do you find to be the most common cause? And is it the same for both men and women?
So male and female hair loss are very, very different in some ways, but it all starts with a genetic tendency. So it's not an old wives' tale that it comes from your family. We know that
you clearly got it from your mother's side then.
Well, we know that that is the old wives' tale,
Right.
actually. It's not always from your mother's side. There's over 200 genes that regulate hair, quantity, quality, texture, color, curl, and the hair loss process. So there's plenty of genes and plenty of blame to go around on both sides of the family. So it's not just your mother's father.
Right.
But if you look at your family album, you could have aunts and uncles, parents and grandparents, great-grandparents, or even siblings who are dealing with the hair loss situation. That definitely increases your risk. The cool thing is that we have technology now to evaluate what's going on at the level of the scalp before it looks thin to the naked eye. So that's the other part of the process, to help us manage the hair loss issue at the earliest possible stage, at the point where it used to be subclinical, meaning that you couldn't see it really from across the room. The dermatologist would send you out the door, you're fine, you've got hair, when actually that look across the room only tells you if they've lost 50% or more of their hair. So measurement tools today, like the hair check trichometer, which is a bundle measurement, or the hair cam, which attaches to an iPhone. These are things that we can use to really see exactly what's going on at the level of the scalp that you can't tell from just a quick look across the room at those patients, men or women. And that gives us the opportunity to intervene, to put them on the path. And then also the opportunity not only just to diagnose what's going on, but to track. Is the situation getting better in some areas, or is it getting worse? Are we doing the correct treatments? Do we have to change or modify? And it's different for every patient.
So it's a common fact that hair restoration can be an expensive process. I noticed on your website that you established a foundation and you do quite a bit of pro bono work. Can you tell us about that?
Yeah, so one of the things that's been a part of the practice for 20 years since we started is our effort to provide pro bono work, evaluations, treatments, procedures, devices to those who are in need and who maybe are less fortunate due to their situation, socially, financially, what have you, and they could not afford the treatments or procedures for hair restoration. So we've always done that for many, many years, whether it be accident victims who lost their eyebrows through a dog bite or an injury in a car, or someone who had been injured in a fight or something that was not of their doing, and they have a scar that need to be covered with hair, or a young boy with a birth defect and lost hair because of it. So that's always been a part of the practice. But so finally, a number of years ago, we made it more formal. So the Bauman Philanthropic Foundation is a 501c3 foundation. It's a nonprofit that is registered and now can help formally address the amount of people who are contacting us with hair loss issues. And also some of the technologies have changed as well. So it may not necessarily be a surgical procedure, but for someone, for example, just recently who was burned in a kitchen fire as a child, has lived the vast majority of her years, literally almost 30 years of her life, without hair. A devastating situation. We were able to, and she had her entire life on hold for all that time. School and work and everything was off track. So we had the unique opportunity to be able to provide a hair and scalp prosthesis for her, and it was a very exciting day when we were able to restore her full head of hair, literally like that.
I can only imagine.
And see her face light up and learn that she was ready to do simple things like stick her head out the car window as the car was going down the road, in the taxi on the way back to the airport that she was always afraid to do, or to swim in the ocean or in a pool with her friends and not have to worry about them asking about what's going on with that big burn scar that she has across her scalp, or to enjoy a roller coaster or what have you, to really just enjoy life. So the Bauman Philanthropic Foundation is the place where those magical things can happen. And it's been very exciting. And so we try to do as much of that as we possibly can. We give until it hurts, as they say.
That's a wonderful philosophy to subscribe to. So what would you hope that your legacy would be, both professionally and personally?
So I feel like I'm just in the middle of the career right now, so I haven't really thought about what I will leave behind. But I hope people would look back and see that what we've done is, in some cases, pioneered technology that wasn't necessarily so popular at the moment, that our skepticism turned to confidence maybe more quickly as we treated more patients with some of those techniques and technologies than many others in the industry. And so I always look back and say, well, how do you identify the guy that's out in front, the leader? And I always say, well, he's the guy with the most arrows in his back. And so I've taken some criticism for some of the techniques and technologies that we've helped pioneer. But if you look back today, as I mentioned before, whether it be PRP or laser light therapy, cell therapy, minimally invasive hair transplant surgery, many of these things which were really not accepted by the general group of hair transplant surgeons out there, and still maybe not completely accepted, really is turning into the future of hair transplantation and hair restoration. So I hope to leave behind a legacy of innovation, of many, many, many more thousands of patients who are treated, and really blazing the trail for this, for the industry, not only in hair restoration, but also in medicine, anti-aging, and also the beauty industry. And seeing all of that kind of come together as we see now. There's a confluence and a collision of all of these industries coming together and collaborating. And so I see that that will coalesce over the next few years. And time will tell how that works out.
So if you weren't a physician, and I can't imagine you doing anything else because the passion that you exude is just, coming out of every hair follicle, so to speak. So what do you think you would be doing if you weren't a physician?
Oh, my gosh. Well, that's a great question. Well, I do love to ski. So,
Professional skier?
No, I don't think I'd be a professional skier, but, I do love to ski. I don't really like to drive around in the snow. That's why I live here in Florida.
Right.
But I do love to ski. The mountain is my place of zen, and the beach. So, those two are the yin and the yang.
So that's where you'd spend your time. But what would you be doing professionally?
Oh, maybe it would have been something in computer science, perhaps. I remember...
Okay, did we have computers back then?
Yeah, so I'll tell you the story. I remember going to summer camp
right.
At around the time that we were learning how to use BASIC. Don't remember that language.
Mm-hmm.
And the Apple II had just come out, and we were learning on TRS-80s and also programming on the Apple over that summer camp experience. And I remember coming home after that, saying to my parents, "We need a computer," and they were like, "Okay, what does it do?" And I didn't really know how to explain it at that time, but I said, well, you can program it and tell it to do different things. And they're like, do we need that? And I was like, yeah, we definitely need that. So, maybe if medicine wasn't that direction the path that I chose, maybe it would have been something in computer science and programming. And, I watch what the kids are doing today. I mean, my kids blasting through, different programming languages week after week, doing these chapters and such. And it's amazing on what they do and how they do it. So... who knows? Maybe I would have developed an app or something like that. There's still time.
If there's still time, absolutely. Do you think that either of your children will go into medicine?
That's an interesting question. I think medicine is very different today than it was years and years ago, and we can have a long discussion on all of that, I'm sure. But I just want to encourage them to do what they love to do. And they're, I'm blessed with smart kids who have their heads screwed on straight so far, and are good at academics and socially as well. So we'll see what their path will bring. And I know that as long as they have a unique passion for what they want to pursue, that they will be successful in that. And and then that's really the name of the game. And I feel lucky on my own that I found a path that is exciting and works at all the different parts of my brain, whether it be the entrepreneurial side, but also the surgical and artistic side, to help patients and kind of make everything go around that way.
I think it's a wonderful thing that you haven't necessarily set or preordained what your children's future will be. in terms of being a physician, and the world is theirs, it sounds like. You mentioned your mentors, both plastic surgeon and hair transplant surgeon. Do you find that you are a mentor to either future hair transplant surgeons or physicians that are coming up through their education and potentially pursuing this path? Have you had the opportunity to been called?
Yeah, one of the exciting things that has come out of the hair coaching program is many of those physicians who are come through the program want to extend the knowledge that they have learned over that short period. And they may come in just for an observational day to see what we do in terms of surgery, whether it's observing a robotic case or a unique case like an eyelash transplant. And then even taking it one step further, maybe they would spend a week or a month or longer over time with us. And so that's been very exciting. I've had the opportunity to have a preceptorship program in the practice. So just like I feel like it was really important for me at that age as a teenager and going into college that I had that opportunity and how it changed my life, I feel like it's really, really important to give that back and provide really anyone who wants that opportunity to kind of see what we do and see that insider view if they want to. So we've had high school preceptors shadow us in the practice, and it's been very, very exciting to do that.
Why is the field of anti-aging medicine or functional medicine, integrative medicine, whatever it is that you want to call it, why is it important to you personally? Well,
I think the idea of optimizing our health is really at the core of what the A4M and the American Academy of Anti-Aging really stands for. And if I can do that for myself, I can better do that for my patients. And I think that's an important knowledge to have, because we're all born on this earth, but nobody gave us a handbook. Nobody gave us an instruction manual, and many of us have been socialized and have developed habits that maybe are not so good for our longevity, our health, even for optimal body function, muscles and bones, including our brain. And if we can learn how to optimize those factors, we'll extend life and the quality of life. And I think that's pretty powerful mastery of the human condition. And I just hope that more people will see that, and that we're not just in the field of medicine putting Band-Aids on wounds, and that we really need to be a lot more proactive. But I think the trend is going to change where the people, the patients, are going to take a much more proactive role. And it's just we have to teach our patients, how to manage all that, how to manage the information that comes out of the researchers, how to assess and adjust whether things are working for us or not, and realize that what's working for one person may not necessarily work for somebody else. We're all genetically different. So I see that as the future of anti-aging or age management, and I don't think we'll ever conquer it 100%. But if we can learn how to hack those things, hack aging, so to speak, like we hack a hair follicle, then that's fun, and that keeps me interested anyway. I think the body is the ultimate gadget, and I'm a big gadget freak. Technophile. It's no secret that I've got a closet full of gadgets that didn't work, and then I've got another closet full of gadgets that we think work, and looking always for the next one. And so I've always been a tinkerer, and I think that as a physician, you get to tinker with the human body and optimize it. And that's part engineering, part biology, part chemistry, part psychiatry, psychology, and that's fun.
Thank you so much for your time. It's been a pleasure to learn so much more about you, and I really appreciate it. So thank you.
Well, thanks so much for having me, Monica. This has been very exciting and fun to do.